Welcome to my world. Another day, another time, another episode on Ask Akinola video channel on YouTube. Today I shall be doing the usual, imparting knowledge on health matters. The topic for discussion shall be lung infection laboratory diagnosis. The lung is one of the very, very vital organs of the body. Without the lungs, I don't know how anybody can live. Because it's like saying without oxygen, how do we live? The lung is that which makes the exchange of carbon dioxide for oxygen possible, because it has certain organelles, the air sacs, that does this exchange. The air sac is called the alveoli and is contained inside the lung. So as the lung expands, it allows air, that's what we call breathing in, breathing out. It allows air to come in, and that is really seen as oxygen. As oxygen mixes with that area called the alveoli, the air sac area, it now exchanges it for carbon dioxide, which comes out as we breathe out. But the lung is very effective when we maintain the homeostatic state, that is, where there is no disturbance. As usual, disease is called disease, that is, we are no longer at ease. So disease means we are no longer at ease. But when we are at ease, all these things happen without any problem. The body takes care of these acid-basis balances that happens because as the carbon dioxide is released outside, there is a need for a replacement, sort of by the kidney, bringing in the bicarbonate, making sure that there is that is a long process which I wouldn't be talking on. It's more of a physiological process. And since this slide is more interested in the lung infection, I am gradually going towards that. The lung perform very effectively under normal conditions, this exchange of gases, which will usually bring about an imbalance that the lung itself will try to balance with the kidney, so that there is always a balance. There is that homeostasis, that is no disease. We are always at ease. But when there is infection or other problems that are associated with lung diseases, even asthmatic patients, the airways is now narrowed, or anything that prevents this normal function from happening, then the lungs start this disease problem that we see. If there is infection, infection is an outside invasion, when the organism from outside invades the lungs. So this invasion is what really is termed infection. We have the experience, we are still experiencing it anyway, COVID-19, which is coronavirus SARS-CoV-2. The disease is called COVID-19, and it affects the lung, it damages the lung. It does not produce pus because it's small.
Go.
Yeah, the COVID-19 infection, when you look at the cough, because cough is a very important part of lungs infection. Once there is a lung infection, there is always that cough. If you look at all lung infection, cough is there, fever could be there, yes. If it's mild, it may not be very terribly feverish, but the cough is a signal of the lung problem, because we regard the lung problem as lower respiratory tract infection. So most of the symptoms seen with lung infection is that cough. So with COVID-19, there is no pus as such, it's a dry cough. There are other infections, very known and very popular. We call it tuberculosis, Mycobacterium tuberculosis. It really comes down with serious pus, damaging the lungs, and when the patient coughs, you see sputum. This is no longer pus, but serious discharge. That is, the cough is the discharge is seriously thick mucus. The lung infection is also called the pulmonary infection, because the lungs is another name is the pulmonary organ. When this infection is, you want to talk about the infection of the lung, you start talking of organisms that have even their species name as pneumonia. Let's take, for example, the commonest bacterial infection of the lung is caused by Streptococcus pneumonia. There is also Klebsiella pneumonia, Mycoplasma too, pneumonia. So you can always find the species name having connoting that it's a problem of the lungs area, because lung infection generally could be classified as pneumonia. So when you hear anything pneumonia, you are already talking about lung infection. And what is this bacterial pneumonia cough like? The cough is with purulent discharge, just like the Mycobacterium discharge is mucopurulent discharge. So the discharge is exactly what really blocks the breathing, because the air sac, where these air exchanges would happen without, when there is no pus, you can imagine when it is now being blocked with pus, just like the experience we talked about the vessels, the blood vessels being blocked with lipids, this cholesterol. It is exactly narrowing problem where you now have serious chest pain, fever, and other things, because the bacteria will continue to multiply and cause more damages. So the infection of the lung is seriously cough, apart from the fever and other things that are clinical, which I don't need to emphasize much upon, but the cough is the most important specimen to work on for laboratory diagnosis. That's why I keep talking about the cough, because when there is a mucopurulent discharge, is that discharge that is collected and worked upon. Also, when you want to take the partial pressure of the carbon dioxide, you can also do that in the biochemistry laboratory. There are other instruments that you can use to test the function, the pulmonary function test, which are not even a laboratory based. It's ordinary this spirometer that would say much about the function, the present situation of the lung. But those discharges, those discomforts that the patient experience is what the laboratory will now work on. So I will gradually be moving into the slide section where I can help really put down all the various infections, from bacteria to viruses to fungus to mycoplasma. And I think if we look deeply too, we may find some parasites living in the lungs that would also cause serious health problem, because the lung have to really do this exchange, effective exchange of oxygen and carbon dioxide and maintain that homeostatic balance. That is, it has a buffering effect on the blood system, so that the buffer, that is the pH of that area of the blood, is maintained at a normal level. It will not cause a serious problem, because once there is a derangement, there are so many other things that are going to be affected. But for now, if you like what you're getting or hearing from me, please click the like button. If you want to receive more, subscribe and press the notification bell, and for sure more of this will surely come. So I will now urge you to stay on as we move gradually into the slide section, where I can comfortably diagnose and show you the laboratory diagnosis of lung or pulmonary infection. Thank you. Health is wealth. Knowledge is power. That knowledge is what I want to impart with this video. Lung infection lab diagnosis knowledge. You are imparted the various parts of the lungs. You have three lobes on the right and 2 on the left, with the heart occupying a very big space on the left side of it. You can see the definition of the lung. Lung infection is any infection caused by viruses, bacteria, mycoplasma, fungi, parasite, all affecting the lungs. And the problem cause is very known, because there is always that serious sickness. Respiratory system composes of the nose, mouth, throat, the voice box, the larynx, the windpipe, trachea, the large airways and the small airways. These are very important, because once these airways are constricted, that is what usually blocks air to come in the case of people suffering from asthmatic attack, the asthma, because the lungs will not receive air at all, so it cannot even pass oxygen to the other part of the body. The lungs becomes almost like collapse. No matter the effort, the constriction is like they have tied something around or even block your nose when such narrowing or constriction of the small airways or large airways happens. Laboratory diagnosis of lung problems. We have all these type of viruses, so many, uncountable. COVID-19 is the latest. We have experienced all the influenza A or B viruses typed by their H1N1, L2, H2N2, and so on and so forth. The bacterial infection too. The commonest, like I said, is streptococcus pneumonia. You have also Klebsiella pneumonia, mycoplasma pneumonia, Haemophilus influenza, Bordetella pertussis causing whooping cough. Chronic pulmonary infection. You have the tuberculosis. Mycobacterial species are also in abundance. Histoplasmosis. These are fungi appearing as yeast cells. Plastomycosis. Lung fluke, yes, that's Paragonimus westermani, that will now reside in the lung, stay there, causing a serious havoc. The virus lab diagnosis is usually done by easy with electron microscope to really know the shape. The Haemophilus, the influenza situation is always easily inoculated, grown on the embryonated egg. The tissue culture is also useful for growing these viruses. The embryonated egg is very useful, especially when you want to do the hemagglutination test and the hemadsorption test. There is also the ELISA, which is a serological test done to confirm, and the PCR, all for viruses. Bacterial laboratory diagnosis, usually we do the microscopy. Gram staining will tell you the Haemophilus are Coccobacilli, gram negative. The Strepts are gram positive, cocci chains. And ZD staining will also show the acid-fast bacilli for mycobacterial species. Cultural inoculation. You also have the West medium for tuberculous mycobacterial species. Blood agar will bring out alpha hemolysis for strep pneumococci, and the chocolate agar will also help in the diagnosis. Macroncane may not be necessary. Biochemical tests, catalyst positive. Streptococci are catalyst negative. The sugar fermentation test will also prove very effective. PCR test and sensitivity testing to know the antimicrobiome. The parasite and fungi lab diagnosis, usually we use the microscope, and so you look at the exudate or the discharge, or looking for the parasite or the oval of the parasite. The saboroid agar is used to culture fungi, and that should help in identifying the fungi causing the lung problem. If you are happy with what has been presented, please click the like button, subscribe. Thank you.